Okay, today we're going to talk about addiction and drugs. So, what are the major drug classifications? And this isn't like a perfect system, but we're just going to use this as our kind of conversing point. So, we have stimulants, depressants, narcotics, and hallucinogens. So, those are the four main categories that we're going to talk about. So, let's look at each of those classifications in greater detail. So, stimulants or uppers, they speed up the body's functions and the central nervous system. So some of the effects on the body: feeling alert, feeling awake, might lose your appetite, increase your heart rate, elevated blood pressure, might feel exhilaration, and enhance your self-esteem. Some side effects of stimulants could be dizziness, tremors, a headache, flushed skin, chest pain and palpitations. That loss of appetite can also be a side effect. Excessive sweating, vomiting, seizures, anxiety, and paranoia. So what are stimulants? Let's look. Some examples: caffeine, nicotine, Adderall and Ritalin, diet aids like Meridia, methamphetamine, so meth, and cocaine. Depressants or downers, the opposite. Instead of speeding up, they're going to slow down the body's functions and the central nervous system. So the effects of depressants on the body: help you sleep, relieve anxiety, relieve muscle spasms, prevent seizures, lower your blood pressure, and decrease your heart rate. So what are some of the side effects? Well, slurred speech, amnesia, reduced reaction time, impaired mental functioning and judgment, loss of coordination, headache, lightheadedness, blurred vision or dizziness, and nausea or vomiting. So what are some examples of depressants? We have alcohol, benzodiazepines, which is like Valium and Xanax, Rohypnol, date rape drug, Ambien or Lunesta, sleep medications, and GHB, also a date rape. Narcotics or opioids. They slow down the central nervous system and relieve pain. So narcotic or opioid effects on the body include pain relief, reducing tension, reducing anxiety, reducing aggression, causing drowsiness, the inability to concentrate. Those may lean toward more side effects, obviously. So what are some side effects? Slowed breathing, slowed physical activity, constricting your pupils, constipation, losing your appetite, nausea, vomiting, also again, that excessive sleepiness or losing your coordination. What are some examples? Heroin, opium, morphine, codeine, oxycodone, fentanyl, hydrocodone. Hallucinogens or psychedelics. So they alter and affect our senses. So they alter our human perception, our mood. Let's get into it. So we could have an elevated heart rate, increased blood pressure, our dilated pupils, sensory distortion, that being the big one. So some side effects are hallucinations, hence hallucinogens, confusion, trouble concentrating, dizziness, blurred vision, clumsiness, sweating or chills, vomiting, numbness. Some examples: LSD or acid, mescaline, peyote, psilocybin, shrooms. So what's an LSD flashback? So that's experiencing hallucinations days, weeks, months, or even years later after taking that drug. It's possible with any hallucinogen, but it is most common after taking LSD. And sometimes someone might experience just occasional flashbacks, but there are people who have consistent flashbacks, which then makes it almost impossible to function normally. Many drugs don't fit neatly in one category. So I'm just going to give a couple examples. One is ecstasy, MDMA, Molly. It's a stimulant and a hallucinogen, so increased heart rate, blood pressure, lowers inhibition, raises body temperature, enhances sensory perception, an increased sense of well-being, greater empathy. Okay, so it fits into multiple categories. Next one, cannabis or marijuana. So the active ingredient is THC. It can be considered a depressant, stimulant, and a hallucinogen. Sometimes that depends on the strain and also your personal response to it. So why would it be a depressant? Well, it can slow down the nervous system. It can be used to treat things like anxiety, insomnia, or muscle spasms, so it can promote relaxation. It can cause confusion, reduce coordination, low blood pressure, slurred speech, slowed breathing, and short-term memory loss. Okay. What about as a stimulant? So instead of a depressant, what about as a stimulant? Well, it can speed up your nervous system. It can increase your attention span, increase alertness and energy. Obviously, this is primarily dependent on the strain of cannabis use. It can increase your body temperature, cause anxiety, paranoia, increased heart rate, and even seizures. And then what about as a hallucinogen? So it can alter your sensory perception, create some time distortion, actually have hallucinations and paranoia, can lose control of your motor skills, increase your heart rate, cause some nausea and dry mouth. Okay. Now, what is the reward pathway? So this is important to understanding how drugs work, addiction, tolerance, a whole bunch of things. So the reward pathway involves dopamine. So dopamine is released whenever we experience something rewarding. So, and the purpose is to reinforce that behavior. So it helps to aid our survival. So, oh my God, that food was so delicious. I definitely want to have that again. Okay. It reinforces it. It creates motivation for beneficial behaviors. So evolutionarily, that's things tied to food and sex, because obviously you need to survive and reproduce. Essentially, we're chasing dopamine. Find a $50 bill on the ground? Imagine, how does that feel? Rush of dopamine. Have pleasurable sex? Rush of dopamine. Find the perfect gift for someone? Rush of dopamine. Eat a delicious food? Rush of dopamine. Dopamine itself does not actually produce the pleasure. Dopamine is a motivator, reward. It links things that make you feel good with a desire to do them again. So, oh my gosh, like finding the perfect gift for someone, that's fantastic. And then dopamine is like, you should probably do that again. Okay. That meal was amazing. You should probably do that again. Okay. Now, it's not always a good thing. So we'll talk about that. But what is tolerance? So you may have heard that word thrown around before. What does that actually mean? Well, the reward pathway has been overstimulated. So too much dopamine is being released. So the brain responds by decreasing dopamine production and or reducing dopamine receptors. It's like, oh my God, there's so much dopamine. I can't. So it's like, you know what? I think we should let's not make as much dopamine. Or let's remove some of these receptors because this is just too much going on. Now the rewarding behavior or the drug has less of an effect. So the craving, that motivation is still there. So it's going to take more and more of the behavior or the drug to get the same effect. So tolerance plays a role in addiction. There's physical dependence, which means your body adjusts to consistent use of a drug. To maintain homeostasis, you now require that drug because your body lessened the amount of dopamine produced, took away some receptors. So that drug needs to constantly be around for that dopamine level to be good, at homeostasis level. So withdrawal is going to begin occurring without the drug. You can also have psychological dependence. So that means the drug becomes, or the behavior becomes central to your thoughts, to your emotions, to your activities, to your routines. So there is an urge to use the drug or do the activity, even if you know the harmful effects. You have this urge to do it, and it's not it's not like you're experiencing bad physical symptoms. It is this urge to do it no matter what. It's because it is so inherently linked into your thoughts, your emotions, your feelings, your routines. So then what is withdrawal? Well, withdrawal is experiencing some physical and mental symptoms after stopping, reducing, eliminating an activity or drug use. So it can occur after reducing an activity or drug use. And that activity could be something like gambling, like shopping. Okay. The drug could be something like caffeine or nicotine, or something that is more problematic, like heroin. So you might get a headache. So people get caffeine headaches all the time. Sign of addiction. If you weren't addicted, you wouldn't get a headache from withdrawal. So headache, anxiety, fatigue, sweating, vomiting, depression, seizures, those are all things that can happen during withdrawal. Okay. Now, what I do want to tell you about alcohol withdrawal is that it is extremely serious, and you can actually die from those withdrawal symptoms. So if someone is an alcoholic and has been consuming large amounts of alcohol, it is important to go through that withdrawal process under medical supervision. Okay, so something to take into account. That may mean at the hospital, it may mean at a rehab facility. So withdrawal from some drugs, and alcohol is one of them, the response is extremely serious and can itself be life-threatening. So remember, addiction is not just a drug thing. It's shopping, it's gambling, it's so much more. Okay, it is not just drugs. People become addicted to many things. It could be your phone, online time, pornography. So what is abstinence? Abstinence means completely abstaining from drugs or alcohol or behavior. It's kind of the more traditional treatment route, but it is not the only option. Okay. So there's something called harm reduction, and harm reduction aims to reduce harmful consequences. And it may help people who are struggling with quitting or who may have relapsed once or more than once. And it may help those who don't want to quit or maybe don't see their struggle as an addiction. So reducing the harm, that might actually save their life. Okay, so that is a viable alternative when quitting for one reason or another isn't an option. And sometimes it's because people have so much other stuff going on that quitting, that going through that process is just not a thing they can have on their plate right now. And that's okay. So reducing the harm from that is important. So what are some examples of harm reduction? Well, it could be overdose education, letting people know, access to Narcan, naloxone, supervised injection sites, access to clean needles, access to counseling, PrEP, which is a medication which can help to reduce the chance of you getting an HIV infection, free condom distribution. So example, not tied to drugs, seatbelt legislation legitimately is harm reduction. So is concussion protocol. Okay, so not everything that we do that fits into that harm reduction category involves drugs and alcohol. Okay, and a lot of things are meant to reduce the harm to our bodies. The nicotine patch, consuming water while drinking alcohol. Also things like income support, maybe healthcare, all different kinds of things that can help support people. So saying someone should just go to rehab, that may take 60, 30, 90 days. What do they do without income? Okay, what happens to their children if they have them? What happens to their family? What happens to their job? So maybe we need layers of support to help reduce the harm so people can seek help if they do need to. And that is just kind of a quick overview about addiction and drugs, and I hope you learned something new.